today with the story of a scientist, I'm going to tell you like how reimagining the reality can change the course of your life and will enable to achieve your goals, dreams you may have. So, I run a bioengineering lab at the Institute for Stem Cell Biology and Regenerative Medicine, which is located in Bangalore. Our lab primarily focused on developing biomedical innovations to solve the unmet clinical needs to impact the society. Exactly 20 years ago, I obtained my PhD from Indian Institute of Science, Bangalore. During my PhD, I was focused on understanding the fundamental principles of self-assembly, how modulating the chemical structure can modulate the properties of the materials. While I had a great time doing the basic science, there was always a small dissatisfaction, or the feeling of emptiness or the incompleteness was like haunting me, because for me, like if I can't foresee how my research can be actually address the real life problem, that always makes it like incompleteness, right? So, despite being at the one of the premier institute in India, due to lack of my own awareness and due to lack of examples where people walk through this path of translational science, that changed the perspective. And what I used to think that like all the innovative technologies can be developed only in the industry, and whereas academic labs merely focused on the developing this wealth of the knowledge, right. So, that was the perception I had. So, that made me to decide to take a long career path to join in an industry to develop innovative technologies to solve the real life problem. So, before that I wanted to get postdoctoral training. So, fast forwarding few years, while I was doing my postdoctoral research at Harvard Medical School, I was fortunate to observe and interact with some of the best translational scientists in the world, such as like Bob Langer, Jeff Karp and so on. So, then I realized that indeed actually you can make world class technologies in the laboratory setups and you can translate them using science entrepreneurship through the market. So, that had a very impact on me, like it is a huge revelation for me. However, as a human beings, like no matter how much theoretical knowledge you have, unless you get into action and realize yourself, you do not believe them. So, that is where I realized like I wanted to work on a much more medically relevant technologies. And there are several millions of people across the world, they suffer with this metal induced contact dermatitis. When you wear jewelry or accessories, get exposed to metal, they go through the skin and they activate your immune system that causes huge discomfort, right. So far there was no technology available. So, what we have developed is we developed this hydrogel consists of a tiny nanoparticle system which can you apply like a daily moisturizer. But what it does is all this nanoparticle, they captures all the metal and prevent them going through the skin. In that way we can completely prevent this entire metal induced contact dermatitis. Just to give an example, if you see when you expose animals to metals without having this cream, they have the severe skin damage. Whereas, when you have this such a nanoparticle based cream, that can completely prevent it. So, once we developed this technology, again we patented, then we want to translate that. So, we went and started a startup company in Paris, then we have conducted human clinical trials. This is like one of the example, a person has the severe contact dermatitis, a simple wedding ring can cause severe contact dermatitis. But using this technology, one can able to completely reverse the phenotype, right. And then we have launched several products through this company, and the millions of people across the world started using, and phenomenally they are giving the feedback, and these are some of the testimonials how they are using this technology and feeling better, right. So, that is so inspiring for us. In fact, that also reiterated that like if we have a clear vision and a creative thinking and the grit to solve the problem, one might be able to develop the technology in academic lab itself and translate them into the society. So, that made me to revisit my decision, which I wanted to go to industry and join develop the technologies from there. So, then I completely changed. I wanted to continue in academic lab and develop that much more larger number of technologies, diverse medical applications. Again, took that dream and come back to India, then I started a lab in InStem in Bangalore. This painting like recapitulate the vision of our lab. So, we want to develop chemical and biotechnologies to improve the health of both human, veterinary and agriculture applications. But before I discuss some of the examples, I will give away the secret of or magic recipe of the success of the translational research. There are two major factors influence how you can conduct the translational research. One is like identifying the unmet need. It is absolutely critical that what problem you try to solve it, right? How do you select that? Is it merely not based on the number, market size and so on, but rather what kind of impact it can have on the society, right? Just for example, as you know, for discovering any new drug to bring it to the market, it takes more than $1 billion of investment, 10 to 15 years of time, right? Imagine you put all the time, money, resources, you develop a completely new drug for treating a headache. Does it have an impact? Not much so, right? Because today, if I feel a headache, I can walk into any medical shop, buy like 4 different kind of medicine, right? Adding one more to that shelf, like how much impact that is going to make it. But on the contrary, think about the sepsis, which is like systemic infection disease, right? Today, absolutely there is no single technology to treat the sepsis patient. It's almost like death sentence, right? Then if you can develop a technology to treat the sepsis, even 50% you are successful, the millions of people you can save. That is the kind of impact you want to have. Select the problem accordingly. Once after that, like you have to develop very innovative technologies, right? So whenever you are developing technologies, there are 3 categories one can develop. One is like a me too technologies, meaning there are multiple solutions available. So you can come up with a new example which works very similar to that, but it doesn't have much conceptual novelty. So these can serve as an example, but doesn't really give you intellectual property or doesn't have much impact. The second category is like a me better technologies, meaning like there is a solutions are there, but you come up with a completely new system which works much better than whatever the existing systems are there. So this can lead to again like a good intellectual property, but again you have the very restricted freedom to operate. The third category is like a me only technologies, meaning like you think about, select the problem which doesn't have any solution and think about the approaches which conceptually nobody thought about it. If you can crack that problem, that will lead to completely first in class of technologies and gives you huge, large, strong intellectual property as well. Certainly these kind of technologies actually laid the foundation to form the startups and so on. So but here only like it's very important thing is like a inventor biasness comes, because whatever I develop things like that is the best, right? So this is where one need to be absolutely critical and harsh to see exactly the idea what you develop, which category this falls in according to make the plan. So by inculcating all these properties, like we have been focusing last 10 years at InStem, we have been developing technologies like to improve the human health. These are including medical textile, discovering novel drugs, and developing biomaterials to delivering these drugs and the medical devices and so on. So in the context of medical textiles, we have been focused on developing technologies to protect the farmers, because farmers in India and developing countries, they spray pesticides without having any protection. It falls on their skin, they inhale. These are highly neurotoxins, right? It can go, once they get exposed to it, like it paralyzes neuronal system that leads to severe health conditions such as like vomiting, diarrhea, loss of vision and death as well. So that shows that there are absolutely no technologies existing to protect them. That's where we decided to develop 2 classes of technologies. One is like having a anti-pesticide gel which can be applied on the open surfaces of the body. But this gel shouldn't be act as a physical barrier, because pesticides can easily pass through them. That's why we designed these chemical scissor-based active gels, where any pesticide comes in contact, this gel can chemically react and deactivate in such a way that it can no longer cause the toxicity. And after that, like however, person can apply on the hands and face, but applying to all over the body whenever they go for farming is not compliance, right? So that's where we wanted to develop this anti-pesticide fabric. You can take the cotton fabric, again these specifically designed molecules can be covalently attached to them. Again, these molecules have the ability to deactivate any pesticide that comes in contact. Now you can stitch this fabric into suit and face mask and so on. Just to give an example, if you take animals and expose to the pesticide with a normal fabric, every single animal they die because of the neurotoxicity. But the same dose, if you expose through your anti-pesticide fabric, 100% survival you see, that clearly suggests the potency of this technology to save the farmers. So again, to translate this technology, we formed a startup company in Bangalore, and we manufacturing these suits. We call it as a Kisan Kavach. Now in next 4 months, like we are planning to bring to the farmers. So in the same medical context, medical textile context, like during the pandemic, we developed another germicidal fabric technology to prevent the infections, because as you know, like during pandemic, wearing mask has become inevitable, right? But if you think about all the masks, like a N95 or fabric or surgical mask, these are fantastic filtration devices. That's how they filter and prevent the exposure. But there's a lot of clinical studies have shown that all this virus and bacteria can accumulate and remain active on the surface of this fabric for several days. So one can, when you touch them, like one can get the risk of the infection, or if you discard them, that can spread, right? So that's where we wanted to develop this antiviral fabric, where again there are specially designed molecules which can be covalently again attached to the fabric. Now this fabric not only acts as a filtration device, but when it comes in contact with any virus, bacteria, it ruptures their membrane, kills instantaneously. Again, to translate this technology, like we formed another startup company in Tirupur, which is close to Coimbatore, which is textile hub of India. And through that, like we launched in the market, and millions of people used during the COVID. And interestingly, if you see, like any typical medical technologies take like 5+ years to bring to the market. For this example, right from concept to commercialization, we took less than 8 months. And that is despite of like a peak pandemic and multiple lockdowns. That shows the, we were a lot more creative in commercialization rather than like, developing the technology itself. So that brings to like our another effort where we are developing new drugs to treat the inflammatory disorders such as like ulcerative colitis. Typically when we see like in our gut, right, our gut is like pipe, right? So it always has a single layer of cells called epithelial cells, and these cells were tightly knitted with the tight junctional proteins like stitches. So this single layer protects from, because we have the billions of microbes in our gut. So this barrier protects them coming into the systemic circulation so that we can prevent the infections. But however, during these disease conditions, they lose these stitches and it causes the leaky barrier. So when you have the leaky barrier, microbes get into, then that causes infection, your immune system get activation, and that leads to the chronic inflammatory disorders. And today all the drugs available to the market are like they're anti-inflammatory drugs or immunosuppressant drugs, meaning they can take care of only effect but not the cause. That's why like when the people even they take for years medication, if you stop, it relapses. So that's where what we thought is, can we develop the system that can completely reverse the or potentially cure the disease? For that, like again, we extensively study the biology of the microbes and the metabolites, and we come up with small molecules which can actually stimulate your cells and produce these stitches back and recreates this entire barrier function. So when you close the barrier, there is no further infection that completely cures the disease. At least in the preclinical animals, we have seen reversal of the disease. And again, to take this technology further, we formed a startup company, pharma startup company in Boston, and now we have 4 potential molecules which can go for the phase 1 clinical trials very soon. So not only having the discovering the new drugs, but we need to have the innovative way to deliver them, right? That's very important. So one of the concepts what we are developing is the disease responsive drug delivery system, because as I mentioned, like say you take the again inflammatory bowel disorders. When you get the colitis and Crohn's, it's not like that your entire gut get inflamed, right? You have patches of the inflammation. But today, if you take any oral medication, whatever the drug goes to your inflamed tissue, your neighbor healthy tissue also get the same dose. So that leads to severe side effects. So it's ideal to have a system which can sense this gut and go to bind and specifically only to the inflamed tissue and release the drug. Then we can eliminate all the side effects that may have. The question is like how one can design, right? And as I mentioned earlier, when you have the leaky gut, that leads to infection. So our immune system has a primary defense to curb the infection. They produce these biomolecules called antimicrobial peptides. These all are cationic in nature. So because of that, if you see the inflamed tissue, it is completely positive charged tissue. So therefore, like we designed this nanoparticle where you can put your drugs and encapsulate them, but has the appropriate negative surface charge, which is the complementary. Now, if you take them orally, they don't interact with the healthy tissue, but wherever you have the inflamed tissue, because of these proteins present, they go and bind and release the drug only in a site-specific manner. And this has very efficient therapeutic efficacy. In fact, one of the clinical conditions we've already completed phase 1 human clinical trials. We are going for phase 2 clinical trials very soon. That brings to our one last example where like in the medical devices context, we have been developing novel blood bags to improve the quality and the shelf life of stored blood. Because as you know, transfusion of healthy blood is the life-saving process, right? In India alone, like every year, we need almost 12 million units of the blood for the transfusion. But through various, blood donations and all, we get less than 10 million units of the blood. But despite of this scarcity, every year more than 5 lakh liters of the blood is discarded, because during the storage, it loses the quality, decreases the quality that leads to discard. So typically what happens when you donate the blood, technically you can store them for maximum 42 days. However, only up to 21 days stored blood is safe to transfuse, because after that the quality declines. And if you transfuse the whole blood, that can lead to severe transfusion related acute lung injury and so on. So how it decreases is when you have the stored blood, they start producing this variety of biomolecules like a DNA, proteins and so on. These are damage causing agents. They attack your red blood cells and causes the oxidative stress. That's how they lose the quality. So far nobody has thought by removing these components can increase the quality of shelf life. Instead of that, people are making a lot of buffers to reduce the stress. So to remove this, if you closely observe this structure, they're again either they're positively charged or negatively charged. So what we thought is, if by designing appropriate polymers with the complementary charges, we can scavenge them very efficiently, and we fabricated a nanofibrous scaffold. Now we can take this bad blood which contains this damage causing agent. If you pass through them, or this device can capture all of them and gives the pure blood. So just to tell you, by using this technology, even 42 days old stored blood quality is as good as freshly collected blood. That much quality one can increase. Again, to commercialize this technology, we formed a startup company in Bangalore, which will be manufacturing the blood bags and go for the clinical trials very soon. But as I mentioned, translational science is not one-person game, it's a team effort. And we are blessed to have a fantastic, very creative and, excited students and postdocs and so on in the laboratory. And now the multiple of them already formed the companies, then they are leading the technology development. But as I mentioned, by revisiting, reality or reimagining the reality made me change my perception about how translational science is done. That made me to start the bioengineering lab. By past 10 years, in our lab, we have shown that by developing innovative technologies and led to formation of 6 companies and multiple products into the market, it is actually reassuring that indeed it is possible to develop world-class technologies in Indian academia ecosystem, and you can translate them into the market to have a great societal impact. Thank you.